and Brad, the two most famous physical therapists on the internet.
Hello, I'm Sara Meeks, and I have a dream. I have a dream that any person, no matter what their age, gender, lifestyle, ethnicity, or any other factor that you can think of, that person, if they have the condition of osteoporosis or osteopenia, they can go into a physical therapy practice, a gym, a fitness center, anywhere where movement and exercise are being taught, and they will be given a program that is, number one, safe. Hopefully, it will also be therapeutic. I'm here to tell you today that this is not the case for most people. I am working now on these videos for Bob and Brad, and what I've discovered is people are not getting good information about how to deal with these conditions. Some people call osteoporosis a disease, but it is not classified as a disease. It's a condition. Whatever it's called, people are not getting good advice. I've been a physical therapist now for 60 years, and I've spent 37 of those years focusing on the condition of osteoporosis and also scoliosis and spinal stenosis, which came along the way with osteoporosis. Osteoporosis does not occur alone. It occurs with any other condition that you can possibly think of that a person would come into physical therapy or a physician's office for. Neurological issues, joint replacements. Again, it doesn't occur alone, and when someone sees a patient with osteoporosis, they have to consider also their other conditions that these patients might have. I graduated from Ithaca College with a Bachelor of Science in Physical Therapy, cum laude, in 1962. Then I advanced. I have a master's degree in physical therapy. I also am a certified Kripalu yoga instructor, and with the American Physical Therapy Association, I'm a certified geriatric clinical specialist. In 1984, I had been a therapist 22 years, and I saw my first patient with osteoporosis. I was working in a clinic in northern New York, in my hometown of Alexandria Bay, New York, right on the St. Lawrence River, and the doctor called me and said, "Sara, I'm going to refer a patient to you. I've just admitted a patient to the hospital who has osteoporosis and an acute compression fracture of the mid-thoracic spine. You're the expert in this area, and I'm going to turn the care of this patient over to you." Well, at this point, I barely knew what osteoporosis was. I didn't have any research. I had no clinical pathway. I had to figure things out. So the first thing I did was I looked at the patient's x-ray, and I could clearly see the compression fracture right where he told me it was. A compression fracture occurs in the front of the backbone, and usually the vertebra collapses in the front, so it becomes wedge-shaped. And when this happens, other things can happen also, because fracture predicts fracture, and if a person has a fracture, they're at risk for having more. Also, fractures in this area of the body can affect heart rate and also breathing with these patients. The next thing I did is I got out my trusty Gray's Anatomy book that I still had from physical therapy school, and I figured that if the first rule of fracture is to reduce the fracture, and if I have a compression fracture, I need to decompress it. So I kind of had to go by what I used to call the seat of my pants, because I didn't have anything in the research literature or any information about exactly what to do. So my first order was to have the patient lie on the hospital bed on her back. This is called the supine position. So if I use that term again, you'll know what it is. So I had her lie on her back with the smallest pillow she possibly could tolerate under her head, no pillow under the shoulders. The pillow was under the head and the neck, and a roll under her knees to help to relieve any back pain. We saw her, I had an assistant there, we saw her 2 to 3 times a day for ice, moist heat, and the beginning of an exercise program with what are called isometric exercises. What that means is you give muscle contraction with no joint movement. And I was focusing on the extensor muscles of the body, the muscles of the back called the back extensors, which have since been shown in research to minimize the risk of compression fracture. So I was on the right track at that time. This patient stayed in the hospital 10 days. That is unheard of today. What happens today is people are lucky to be in the hospital at all with a compression fracture, and they might get to stay there 3 days. But I had an opportunity to work with her for those 10 days. After she was discharged, we followed her up as an outpatient, and then I saw her at home. She lived in the same town that I did, so I was able to visit her in her home. She was a previously very active 65-year-old person who was working part-time as a bookkeeper. She had grandchildren that she was driving to all kinds of athletic events. Very, very active person, doing her own housework and so on. So at 6 months after the fracture, I had occasion to look at her x-ray again. And you could clearly see on the x-ray that the vertebral body itself had risen to its previous full height. This is also quite unheard of today, because I know that people are told when they have a compression fracture that it's never going to change. That is not so necessarily. If someone with the fracture is seen early enough, it can change, and there has been also research that shows that this can happen. So I felt, because she returned to her original lifestyle after this, that I had had a successful treatment with this patient. And I began to look around at the other patients who were coming into this clinic that I was working in, and I began to notice that I did tend to be treating a lot of elderly people, and as I looked at their posture, I kind of assumed that they might have osteoporosis also. A lot of it is silent and unknown to therapists, and we need to be very careful when we start to work with the aging population. However, I should fit in right here that babies are being born with osteoporosis in our country now, and it is occurring in much younger people. But I was working with an older population, and so I started to give the same exercise routine to some of these patients, especially patients with back pain, patients with neck pain, patients with scoliosis, and so on. And it was very, very successful with these patients. So I figured that I was onto something, and I began to look up more about osteoporosis. Around this time, I became a certified yoga teacher, and I began to modify yoga for the students that I was seeing for more safety and therapeutic intent. So the next thing that happened to me, I happened to work in a clinic this was about 1996, 97, a clinic where every patient that I saw was diagnosed by bone density scan with osteoporosis and/or osteopenia. So that was the primary diagnosis. They also had every other diagnosis that any physical therapist sees in their clinics. I saw people with heart conditions, people with COPD, that's the same thing as emphysema, difficulty in breathing. I saw patients with multiple sclerosis, with joint replacements, just about anything that is routinely seen in a physical therapy clinic. So osteoporosis does not occur alone. It occurs with any other condition that the patient might have. I worked in that clinic for about 14 months, and that's where I refined my program, which is now known as the Meeks Method. This is a trademark by the U.S. Patent Office, the Meeks Method for the management of osteoporosis. Following this, at that clinic, I went back into home care, and then a friend of mine and I were talking, and she said, Sara, you know, you've had a lot of experience now with osteoporosis. You might want to start teaching seminars on this. I thought, well, there's an idea for my future. So I basically put out notice that I was going to be teaching in Gainesville, Florida. That's where I lived then and live now. And I actually had, I think, about 40 people sign up for this class. And so I began teaching, and eventually I began to teach all over the United States and Canada, and I also traveled internationally to teach primarily professionals, physical therapists, occupational therapists, exercise personnel, and also some physicians came to the classes. And I did this right up until the time that COVID-19 came into our lives. Of course, then I couldn't travel and teach. So now I'm focusing more on doing consultations and reaching out to the public, which is an entirely different than teaching professionals. And I'm encouraging those people who are doing the exercises in my program to go back to their physicians and let them know, besides medication and surgery for this condition, there's also exercise and movement that can be very, very effective. So in any case, I'm now working more with the public, doing consults with the public. So this is the beginning of many, many videos that I'm going to be making for Bob and Brad. And I'd like to say right now, thank you to Bob and Brad for supporting my work and giving me the ability to get out to more people and let them know that there is help on the way, and there are many, many things that they can do to deal with this condition of osteoporosis. The next video, this is the end of the first video. The second video, I am going to go through the basic anatomy. You can see my skeletal models here, and I'll be explaining how and where osteoporosis occurs and what we can do about it. Thank you for your time, and I hope you've enjoyed the presentation.